You know, when you break a bone, there's a strangely comforting precision to the whole healing process.
Oh, totally. You go to the hospital, they take an X-ray, and
And you literally just point at the jagged white line on the screen, right? It's broken or it's not broken. You put a cast on it and you just wait.
yeah, it's very straightforward.
But when you step into the world of soft tissue or like trauma and deliberate cosmetic injury,
Yeah.
that X-ray machine is completely useless.
It's a completely different diagnostic landscape. It's incredibly murky.
It really is. So welcome to this deep dive.
Yeah.
Today we are exploring the crucial and honestly deeply misunderstood science of aftercare for collagen remodeling.
Right, because the mission here is to decode exactly what your body needs to rebuild properly after trauma. And, trauma is a really broad term.
Right, we're talking about a surgical procedure, maybe an accidental injury, or even a deliberate cosmetic treatment like microneedling.
Exactly. It all comes down to how human tissue responds to disruption and, more importantly, how you manage that specific response.
And the sources we're pulling from today are just fascinating. We've got clinical guidelines on wound care and cosmetic aftercare from places like Biotti Plastic Surgery and Left Aesthetics, right alongside these really dense biochemical research papers.
Yeah, we've got some heavy nutritional deep dives and research on prostaglandin signaling, too.
Which I have to say, reading through this stack of research completely shattered my understanding of tissue repair.
How so?
Well, I always assumed building collagen was passive.
Yeah.
Like you just take a gummy supplement, you slap a bandage on your knee, and you just sort of hope for the best.
Right, the set it and forget it method.
Exactly.
Yeah.
But it turns out it's this highly orchestrated, intensely demanding biological process. It's not just about a supplement. It's about perfectly timing your nutrition, knowing the exact right day to, start physical movement, and even actively manipulating your body's inflammation.
The timeline itself is what usually shocks people the most.
Oh, absolutely.
Because when we talk about the phases of wound healing, that final stage, the maturation or remodeling phase, it lasts so much longer than people think.
Yeah, most people think you're done healing when the scab falls off, right?
Yeah.
Or when the stitches come out.
Right. But after that initial 4 to 5 weeks of early collagen formation, your body actually spends the next entire year replacing weak temporary collagen with strong permanent collagen.
A full year.
A full year. So the aftercare choices you're making in those first few weeks are quite literally dictating the structural integrity of your tissues for the rest of your life.
That is wild to think about. A whole year of this invisible remodeling happening right under the surface.
Exactly.
So I feel like before we even look at, what serum to put on a healing face or how to move a recovering joint, we have to talk about the internal supply chain.
You can't build a house without bricks.
Right. You cannot remodel tissue without the right raw materials floating around in the bloodstream.
And collagen is a massive, incredibly complex protein. It's synthesized using very specific amino acids, primarily glycine, proline, and hydroxyproline.
Okay.
So the clinical guidelines recommend getting a solid baseline of protein, usually around 1.2 to 1.6 grams of protein per kilogram of body weight, just to make sure you have enough raw material to fuel the whole thing.
But having a bunch of amino acids just like floating around
Yeah.
clearly isn't enough on its own, right? Because the sources dedicate an immense amount of space to vitamin C.
Oh, vitamin C is everything. It's treated as this absolute non-negotiable cofactor.
Right. The specific recommendation I saw was 50 to 100 milligrams of vitamin C paired with, I think it was 2.5 to 15 grams of collagen peptides.
That's right.
So why the obsession with vitamin C?
Okay, to understand that, you have to look inside the fibroblast.
The fibroblast.
Yeah, the fibroblast is basically the specialized cell that acts as the collagen factory in your body.
Oh, okay.
Inside that factory, enzymes have to convert the amino acid proline into hydroxyproline and lysine into hydroxylysine.
Got it.
That whole conversion process is called hydroxylation, and vitamin C is the essential catalyst that actually makes it happen.
And if that conversion fails, like if you don't have enough vitamin C,
The entire structural integrity of the collagen just fails.
wow.
Yeah, those hydroxylated amino acids are what allow the individual collagen chains to twist together. They form this tightly braided triple helix structure.
Like a super strong rope.
Exactly. They create hydrogen bonds that lock that braid into place. So without vitamin C driving the process, the collagen molecule literally can't fold properly.
It just falls apart.
It becomes weak, unstable, and it usually just degrades before it even leaves the cell.
Which perfectly explains the whole history of scurvy.
Yes, sturdy is the classic example.
Because, sailors on long voyages without citrus fruits, they weren't just getting a cold or something. Their actual connective tissues were unraveling.
Right.
The old collagen in their scars would literally break down.
Hmm.
And because they had no vitamin C, their bodies couldn't synthesize new, stable, triple helix collagen to replace it.
So their old wounds would literally just burst open.
That is so gruesome, but it makes so much sense now.
It's the exact mechanism. So vitamin C is basically the biochemical welder keeping the strands of the collagen rope bound tightly together.
Okay, I love that analogy. The vitamin C is the mortar, and the collagen peptides are the bricks.
Exactly.
But wait, I was actually wondering about this. If I need amino acids and I need vitamin C, why can't I just eat like a heavy steak and a side of broccoli?
It's a great question.
Right.
Yep.
Like, why is there such a specific emphasis in the sources on consuming hydrolyzed collagen peptides for aftercare?
So when you eat a steak, your digestive system breaks that complex dietary protein all the way down into individual single amino acids.
Right, it just chops it all up.
Exactly, and it goes into the general supply pool.
Right.
But when you consume hydrolyzed collagen peptides, the protein has already been partially broken down in a very specific way.
Oh, interesting.
Yeah, so some of those peptides are actually absorbed into your bloodstream completely intact as these short chains.
So they survive digestion as a specific sequence.
Yes, and those specific sequences are recognized by the body as fragments of broken collagen.
Oh, wow.
When they dock onto the receptors of your fibroblasts, they send an emergency signal. They basically trick the body into thinking, hey, we are experiencing massive collagen breakdown. We need to ramp up production immediately.
So the dual action, the steak gives you building materials, but the specific peptide chains act as, like, a work order.
That's a great way to put it.
They flip the switch on the factory floor to double production.
And of course, that factory requires an optimal environment to run, which brings us to hydration.
Ah, water.
Water is the primary transport system. You need massive amounts of water moving through the extracellular matrix to carry those amino acids right to the fibroblasts.
And I saw it carries crucial trace minerals too, right? Like zinc and especially copper.
Yes. Copper is so important. It's the mineral responsible for cross-linking those newly formed collagen fibers, tying them together so they can actually handle physical stress.
So if the tissue is dehydrated, the transport system shuts down, the cross-linking fails, and the tissue just becomes brittle and prone to cracking.
Exactly.
Okay, so we've got the raw materials in the bloodstream, the work order has been submitted by the peptides, the factory is pumping out this tightly braided collagen rope.
Great.
But if this new collagen is just flooding my system, how does it know where to go? Like, how does it know to go fix my torn rotator cuff instead of just, unnecessarily bulking up my earlobes?
Right. How does it know where the construction site is?
Yeah. There has to be some kind of homing beacon.
There is, and the homing beacon is mechanical stress.
Mechanical stress.
Remember that 1-year maturation phase we talked about?
Yeah.
The body is constantly swapping out early, weak collagen for permanent collagen.
Right.
The early stuff is type 3 reticular collagen. You can think of it like a disorganized, messy cobweb that just acts as a quick emergency patch.
Just to stop the bleeding, basically.
Right. But the permanent stuff is type I fibrillar collagen, which is aligned like thick steel cables. That's what gives tissues their incredible tensile strength.
So how does the body know exactly which direction to lay down those steel cables?
It follows a physiological rule known as Davis's law.
Davis's law.
Davis's law dictates that soft tissue models and remodels itself according to the mechanical demands placed upon it.
So wait, the physical pulling and stretching of the tissue is literally sending a signal to the fibroblasts.
Exactly. The physical tension tells the fibroblasts to align the new type I collagen fibers directly along the lines of that tension.
Oh, wow.
If you don't move the healing tissue, the body just lays the collagen down in this disorganized, haphazard knot.
Which perfectly explains this crazy concept in the sources from Salt Wrap. They call it the surgery paradox.
Yes, the surgery paradox.
They outline a scenario where you have a major musculoskeletal surgery, like, say, a hip joint repair. Now, my immediate instinct would be to take massive amounts of collagen right after the surgery to heal faster. But they explicitly say you should delay taking any collagen supplements, which feels totally counterintuitive.
Well, think about the environment of a surgically repaired hip in the immediate aftermath. You're immobilized.
Right. I'm in a brace.
You're in a brace, you're resting, you're actively minimizing movement to protect the stitches and the bone.
So if I flood my system with a massive surplus of collagen while my leg is locked in a brace, I'm producing all this new tissue, but providing zero mechanical tension to organize it.
Exactly.
It sounds like it's like trying to run a snowplow during a massive blizzard, but the truck is in park.
Oh, I like that.
Like
Like a
the collagen is the falling snow. You aren't
fusion.
clearing a path, you're just generating this massive solid drift of snow that eventually locks up the entire driveway.
That is precisely what happens on a cellular level. It results in what we call hypertrophic scarring.
Ah.
The body synthesizes the collagen, but because of Davis's law, the total lack of movement means it just builds up as a thick, disorganized mass of scar tissue.
And in a ball and socket joint like the hip,
That excess scar tissue can physically block the femur from rotating. You can permanently lose your range of motion.
oh my God. So the actual aftercare strategy is to wait 4 to 6 weeks.
Yes.
You let the initial trauma settle. You let that messy type 3 cobweb collagen do its temporary patch job. And then the moment physical therapy begins. When you finally start moving the joint, that's when you hit the body with the peptides and the vitamin C.
Because the physical therapy acts as your moving snowplow.
Keeping the driveway clear so the snow only builds up where it's supposed to.
Exactly. You leverage Davis's law to perfectly organize the repair.
That is brilliant.
Now,
Yeah.
that applies to deep structural repairs, but the guidelines for surface-level aftercare like cosmetic treatments, skin resurfacing, minor external wounds, that requires a completely different methodology.
Right, because you aren't trying to rebuild a load-bearing cable, you're just trying to repair a delicate barrier.
Yes.
And the sources focus really heavily on this idea of moisture balance for open wounds. It's described almost like this very delicate Goldilocks zone.
It is. The cellular mechanisms of skin repair are incredibly sensitive to their environment. If a wound is left open to the air and becomes too dry, cellular migration halts completely.
See, my whole life I was told to let a cut air out so it could form a thick scab.
Most people are, but a thick, dry scab is actually an impediment to fast healing.
Wait, really?
Yeah. The specialized cells that need to travel across the wound bed to repair the tissue, they require a moist surface to glide across.
Oh, so they literally can't move.
They get stuck. If it dries out, they can't travel, the tissue becomes brittle, and it cracks open.
Yikes.
But on the other extreme, if the wound is too wet, you experience maceration.
Maceration. That's when the healthy surrounding skin gets all waterlogged and turns white, right?
Yes, and it begins to chemically break down.
Okay, this is why collagen dressings are used in clinical wound care. I was reading about this. They're engineered to absorb the excess exudate, that clear fluid oozing from the wound, while holding just enough moisture against the skin to keep that slip and slide open for the migrating cells.
Perfectly stated. They function as a biological sponge and a structural scaffold simultaneously.
Amazing.
And you also see this need for extreme environmental control in the aftercare for microneedling.
Oh, microneedling is fascinating. Because you are intentionally causing trauma, you're creating thousands of controlled micro-injuries just to force the skin to produce new collagen.
Right.
And the aftercare for the first 48 hours is highly restricted. Like, you are told to avoid sweat, avoid heat, absolutely no direct sun use mineral SPF 30+.
You're protecting a heavily compromised barrier.
Yeah, you're supposed to wash only with gentle, fragrance-free cleansers and apply ceramides and hyaluronic acid.
Well, think about what you've just done to the skin barrier. You've punched thousands of microchannels straight through the protective layer.
Right.
So the hyaluronic acid acts as a humectant. It aggressively pulls water into the tissue to maintain that crucial moisture balance we just talked about.
And the ceramides.
The ceramides act as the lipid mortar. They temporarily seal those microchannels to prevent environmental pathogens from getting in while the skin repairs itself.
Okay, but here's where it gets really interesting. There is this glaring contradiction in these cosmetic guidelines.
Let's hear it.
So after microneedling, the sources explicitly state you must avoid applying active ingredients like retinoids, glycolic acids, and most shockingly topical vitamin C for 5 to 7 days.
Ah, I see where you're going with this.
Right. We just spent the entire first section establishing that vitamin C is the ultimate biological welder for collagen. Why on earth would I banish it from my skin during the exact window I am actively trying to trigger collagen production?
It's a great catch, but you have to separate the internal biological requirement from the external chemical reality.
Okay, explain that.
Internally, ascorbic acid is required inside the fibroblast for hydroxylation, and we know that.
Right.
But externally, topical vitamin C serums are formulated to be highly acidic. They require a very low pH just to penetrate the normal, intact outer layer of skin.
Oh, the acidity.
Yes. If you have thousands of open micro wounds from the needles, putting a low pH serum on your face is quite literally pouring lemon juice onto a fresh scrape.
Ouch. Okay, yeah, that makes sense.
It will cause profound chemical irritation. That massive spike in uncontrolled surface inflammation will completely disrupt the delicate early stages of healing, potentially leading to hyperpigmentation or even scarring.
So you want the vitamin C circulating in your bloodstream, arriving at the fibroblast from the inside, not burning the compromised barrier on the outside.
Exactly. Take the supplement, skip the serum.
Got it. Now, I did notice the same principles of environmental protection apply to vaginal rejuvenation treatments, which are becoming heavily utilized right now.
Yes, they are very common. Clinics use radiofrequency devices or surgical lasers to stimulate collagen production and improve the elasticity of the pelvic floor and vaginal tissues.
And the anatomy is obviously different, but the rules of aftercare are identical.
Completely identical.
The guidelines emphasize loose cotton clothing to maintain breathability, and they specifically warn against synthetic compression garments.
No tight yoga pants.
Right, because they trap heat and moisture, which disrupts that delicate moisture balance. And to protect the tissue from direct physical trauma, patients are told to avoid tampons or intercourse for anywhere from, I think, 1 week for non-surgical RF up to 6 weeks for a surgical treatment.
But notice what they do encourage during that rest period. Gentle pelvic floor exercises.
Right, because you avoid external friction, but you use internal muscle contraction to improve local blood flow.
Exactly. It naturally pumps the necessary internal nutrients, the hydrated peptides, the trace copper, the vitamin C, directly into the recovering tissues without damaging the surface.
It is all about carefully managing the body's biological response.
It is. But perhaps the most surprising element of managing that response comes from what you are absolutely forbidden to do after these procedures.
Ah, you're talking about the NSAE paradox.
Yeah.
Okay, let's unpack this, because almost every procedural source we pulled, whether it's for a fractured bone, a joint repair, or facial microneedling, has a strict warning to avoid non-steroidal anti-inflammatory drugs. No ibuprofen, no aspirin, no naproxen.
None.
If you take these common painkillers in the days following a tissue trauma, you actually impair the remodeling process.
Which is hard for people to accept because we have been culturally conditioned to view inflammation as this enemy that must be crushed at all costs.
Right. If it's swollen, take an Advil.
But acute wound healing is entirely dependent on an aggressive inflammatory response.
The research on bone fractures really illustrates this perfectly. If you take an NSAI, after breaking a bone, it severely decreases the expression of something called collagen X.
Yes, collagen X. It's a highly specialized temporary collagen.
How does it work?
So, during a bone fracture, specialized cartilage cells called hypertrophied chondrocytes swell up at the site of the break. They secrete collagen X to create a temporary calcified scaffold. This scaffold basically holds the broken pieces together so permanent bone can eventually replace it.
But if you take an NSAA, you suppress those cells from expressing that scaffold. The broken bone literally can't bridge the gap properly.
And the body ends up forming weak, fibrous defects instead of a solid, unified bone.
That's terrifying. So why do NSAIDs do this?
The biochemistry revolves around Chios enzymes. NSAIDs work by blocking Chiox enzymes, which normally produce a vital lipid signaling molecule called prostaglandin E2 or PGE2.
Right. And in the event of an acute injury, a surgical incision, a break, or a microneedling wound, your body relies on a massive spike of PGE2. It acts as a chemical flare gun.
A very loud flare gun.
It alerts the immune system, recruits the fibroblasts to the area, and triggers the release of the growth factors needed to rebuild.
And if you take ibuprofen, you intercept the flare. The signal is never sent.
So acute inflammation is basically the demolition and prep crew. They show up, they clear the site, and they lay the foundation so the builders can work. If you take an NSARD, you fire the demolition crew. And if the site isn't prepped, the fibroblasts, the builders, can't lay down the new collagen.
In the context of an acute wound, yes, you absolutely must let the demolition crew work. But, and here's the fascinating twist, we also looked at skin that isn't injured but is simply aging chronologically.
A paper from the MDPI Journal of Molecular Biology. They looked at normal human dermal fibroblasts in aging skin.
And what did they find?
They found that as we age, our skin begins to chronically overproduce those COX enzymes, which means our aging skin is constantly flooded with a low, persistent level of PGE2, even when there is no injury at all.
And this chronic baseline elevation of PGE2 behaves completely differently than an acute spike.
It does the exact opposite.
Yeah, right.
The paper reveals that in aging skin, This chronic PGE2 presence actively inhibits the expression of procollagen. It essentially shuts the factory down.
Yeah.
And even worse, it triggers the release of MMP1.
Ugh, MMP1. It's a matrix metalloproteinase. You can think of it as a pair of rogue biochemical scissors.
It just wanders through the extracellular matrix, actively snipping and destroying the healthy collagen you already have.
It's terrible.
So if acute inflammation is the vital demolition crew that preps a fresh wound once, chronic aging inflammation is like a rogue demolition crew that permanently moves on to the site.
Yes. They shut down new construction and spend all day tearing down your existing bricks.
Which is why the researchers suggest this wild therapeutic reversal.
Exactly. While taking an NSAI ruins acute healing by blocking PGE2, finding a way to topically inhibit PGE2 in healthy aging skin might actually be the key to stopping age-related collagen loss.
It would essentially evict the rogue demolition crew from the site.
It's incredible, right? A signaling molecule like PGE2 isn't inherently good or bad. It is entirely dependent on whether the context is acute repair or chronic degeneration.
Man, so what does this entire biochemical orchestration mean for your aftercare? It means there is no single magic bullet for collagen remodeling.
No, it requires a complete systems-based approach.
You have to supply the internal nutrition, ensuring the peptides are sending the work orders, and the vitamin C is welding the triple helix together.
You need aggressive hydration to keep the transport lines open for copper and zinc.
And you have to master mechanical signaling, using Davis's law to move the tissue at exactly the right time to guide the building process, while intentionally delaying supplementation if you are trapped in a cast.
You also have to curate the external environment, managing the moisture balance with advanced dressings, protecting the compromised skin barrier with ceramides, and keeping acidic serums away from fresh microwounds.
And crucially, you have to respect the biological process of inflammation. You have to endure the discomfort of an acute injury without reaching for the NSAIDs, allowing your body's demolition crew to prep the site properly.
It's just a remarkable look at how our bodies continuously adapt to their environment. And, when you realize how profoundly our physical reality shapes our biology, especially through Davis's law, it forces you to think about our everyday habits.
Oh, like what?
Well, think about modern posture. We know that soft tissue models and remodels itself based on the mechanical stress and tension placed upon it.
Right, Davis's law.
So, what does our daily modern posture, hunching over phones and laptops for hours and hours a day, mean for the ongoing invisible collagen remodeling happening in our bodies right now?
Wow.
If the fibroblasts lay down new permanent type I collagen along the lines of tension, are we structurally remodeling our own tissues to permanently trap us in our worst postural habits?
That is a terrifying thought to leave on. You're literally cementing yourself into a hunchback. Well, something to think about the next time you're scrolling on your phone. Thank you for joining us on this deep dive into collagen remodeling, and we'll see you next time.